Katrina, are you there?
Yes, I am.
I've just checked the link, and the link suggests that it's not open to attendees. Would it be the case that it doesn't go live completely until the hour?
That could be it. Let me have a little
Okay.
look.
Or unless I can't open both, but
On my screen it says it's in progress, but that there's only one person registered.
and who is that?
Let me reload the deck. Oh, it's Dan.
Just to make sure that I've sent the right link, and I can send it out very quickly now, otherwise.
Okay, let me do copy registration link, and then let me pop this into the chat box for you.
Thank you. Just in case.
And then let me see what happens if I click that. Yeah, I'm not sure if it's going to like it if I, well, let's see what happens.
I wasn't getting that actual message.
Oh, yeah, it doesn't like that, does it? Okay, maybe now because it's turned 2 o'clock.
Yeah, that's because it's a meeting, that perhaps there could be a
Is there a start meeting button?
There's a start broadcast, which we've done. So we're technically live now.
So the chat, this chat now is that link. This is a slightly different link to the one I had. Uh-oh. Right, quick email to everyone. Start a few. Yeah, so I think somehow the link that I had taken was not active. So I'm just resending that. Apologies to everyone. It's a major glitch on my behalf.
John, I've just taken you off controls on this end so it doesn't go a bit bananas, but I will try and remember to put you back on in 2 minutes, but just remind me if not.
Oh, I hate technology sometimes.
Hello there. Am I the only one on this?
Hello.
No.
Sorry, we're having some.
Hello.
We're having some link issues here, folks. Apologies for the delay. We're just sending out a corrected link. There was some issue with one of the links, so we have just sent an email out, and we will start in a few moments. Thank you for your time, your patience.
Thank you for that update. We were all quite worried about you.
Okay, so we have a number of people that have joined via phone connection. Okay. Okay, so
There, that's working now, John.
yeah, so for some reason we had some sort of connection issue or link issue there. I think I will begin because really my part of the presentation is really just to introduce everybody. So I believe I have control of the screen. Yes. So good morning, good afternoon, or good evening, respectively, to all of you. Welcome to the 6th webinar in the air pollution mitigation series for the built environment. Today's topic is the international agenda for urban air pollution and mitigation. And this is a very exciting lineup of speakers, and I'd like to thank personally all of the speakers who have joined us from various international organizations. So we're going to get very nice and intriguing perspectives of different regional and international organization flavors of what air pollution and mitigation is in different parts of the world and the various initiatives that are ongoing in this space. So without further ado, we have 5 different presentations. Katrina Brady from the World Green Building Council will open up in a few moments, followed by Sandra from the Climate and Clean Air Coalition, Pierpaolo Mudu from the World Health Organization, Dang Espida Casanova from Clean Air Asia, and Martin Schneekloth from the European Commission's Clean Air Unit. And they're going to give some very interesting talks over the coming hour. Each presentation will take about 10 to 12 minutes each. And you have the opportunity to pitch questions in the chat box throughout the session. But we will have a group or panel discussion at the end where all of the 5 speakers will be given opportunities to respond to your questions. Of course, during the presentations, please send your questions to us throughout, and the speakers can respond to you in the text box to ensure that we get as much covered during the hour as we can. So, and also at the very end, we'll just give a flavor of what's happening in terms of this broader webinar series. So what this webinar series is about, it's a collaboration between myself, John Gallagher here in Trinity College Dublin in Ireland, and working with the US EPA and Cornell University, we put this webinar series together. Basically, it's to promote the field of air pollution mitigation, specifically passive air pollution mitigation, which is a very active field of research, but what we need is international connections and sharing best practice. And so today it's all about sharing best practice in terms of international agendas in different parts of the world. And as I've mentioned when I introduced our 5 speakers from various organizations that have very strong and very important messages in terms of air pollution and mitigation measures and the impacts, the initiatives, and so on. So I'm very much looking forward to hearing from them, as I assume you all are, and thank you for joining. So without further ado, our first of our 5 presentations is Katrina Brady from the World Green Building Council. I'll hand over to her and we will go through these 5 presentations over the coming hour. And then, as I said, we will have the Q&A shortly afterwards. So Katrina, I will hand over to you. Thank you for joining and look forward to hearing your talk.
John, thank you so much. And I echo the introduction to everybody else. Thank you for joining us. My name is Katrina Brady. I'm speaking to you today representing the World Green Building Council. My role is Head of Better Places for People, our global health and wellbeing project, and I'm going to talk about air quality with a built environment focus. So, quick introduction from me. I work for the World Green Building Council. We are a global non-for-profit network, a membership organisation of 70 national green building councils. Each of these green building councils represents its own membership organisation, and collectively we represent around 40,000 organisations committed to a sustainable built environment. The green building councils around the world do a number of different things. They're each independent non-profit organisations, but they work around the areas of collaboration, innovation, communications and awareness raising, rating and certifications, education and training, advocacy and strengthening policy. So the green building councils around the world are totally globally distributed and organised in 5 regional networks as well: Europe, Americas, Asia Pacific, Africa and Middle East and North Africa. And we've spent a lot of time in the last year aligning our strategy for our organisation with the Sustainable Development Goals. And what we've worked out is that the 3 areas of the built environment that we believe we can have the biggest contribution in terms of working towards a sustainable built environment are climate action, resource efficiency, and health and well-being. And I run our health and well-being programme at the World Green Building Council, and that is where this air quality section of work sits. So moving now into the air pollution conversation. As I mentioned, we are a membership organisation. I run a project that's active in 35 countries of the world. And as part of our strategic conversations last year, we were talking about which area of health was most fundamental for us to drive impact in, to engage our members around. And it was really immediately clear to us that air pollution is really rising up the political agenda. It's getting mainstream media headlines, making headlines around the world, and really rising in terms of awareness for the public as well. So we are, of course, a buildings-focused organisation, and one of the things that's incredibly important to us is that we use our potential impact and value as a buildings-focused membership organisation to reduce the contribution of the built environment to the global air pollution crisis. So because of that, we've been very delighted to partner with the Climate and Clean Air Coalition, which we did earlier this year, and they have helped us to launch our campaign that's about promoting a sustainable built environment that mitigates both the cause and effect of air pollution, reducing harm to people and planet. And our 4 specific aims, breaking this down a little further, is that we want to reduce the contribution of the built environment on ambient outdoor emissions. I'll go into what some of these are later. Secondly, we're not just talking outdoor air, we're talking indoor as well, and we want to be mitigating the indoor air pollution sources that harm human health. Thirdly, and maybe the most important, is that we want to be promoting sustainable building operation, recommending strategies that go hand in hand with our other focus areas of climate action and resources and circularity. And then fundamentally increasing awareness and action. So moving quickly through this just to keep to time, but I think it's so important to share some of the causes of air pollution that do come directly from the built environment. And let's look at ambient or outdoor air pollution first. And I'll go high level, I'll start looking at energy, but it's a relatively well-known statistic that 39% of global energy-related carbon emissions are attributed to buildings. That includes the construction stage, but our built environment is clearly a huge contributor to greenhouse gases being emitted around the world. So fundamentally, that's one of our causes of air pollution. Focusing down a little more on construction, this is an issue in causing air pollution, both in terms of the, if you'll excuse the pun, but creating the building blocks of our built environment, and actually the more localized air pollution impact. So it's both the creation of materials like bricks, reduce a huge number of short-lived climate pollutants, but as well, those other heavy industries are huge contributors to the embodied carbon and locked-in emissions that are a big factor in a building's entire life cycle contribution. A bit more localized, we know obviously that building sites are often not the healthiest places to be in the world due to the release of toxic gases and dusts. But then looking at a building in an operational phase, unless you live in a part of the world that is perfectly blessed with a totally comfortable climate year round, most of us rely on heating and or cooling. Here in the UK, we're definitely moving into heating season, but really in all areas of the world, developing but also developed markets, we're still seeing that combustion of fuels releases a huge number of short-lived climate pollutants like black carbon. And cooling, likewise, where we're having to use air conditioning systems that release hydrofluorocarbons, then that is a potent climate force and contribution to climate change. But then interestingly, I think the indoor conversation is just as relevant. And for many of our green building councils around the world, we have some countries who are blessed to have fantastic outdoor air quality, but they say that in their markets, the indoor conversation that's rising to the forefront because of the health consequences that are rising from indoor air pollution. So it's important for us to address both as a global organization. But again, some examples, heating once again comes up a lot of the time when we're combusting these fuels within the home primarily. That is localized indoor air pollution. Then a little bit more building focused, but damp and mold is a huge factor, particularly here in Europe. The rate of retrofit of buildings is very low. A lot of us live in old houses, and a lot of these buildings are not totally watertight. It's quite easy for water to get in through cracks in the building exterior, condense when it comes against a warmer indoor temperature. That can turn into damp and mold, and then you have this microbial airborne pollution that moves inside your building, and that can be particularly harmful to vulnerable populations such as elderly people, children, and is particularly risky if you suffer from health issues like asthma. Also in that land, we've got the chemicals issue. VOCs, volatile organic compounds, are very well known as being some of the most harmful chemicals that are emitted from our materials, furniture, fabric, our cleaning products, lots of the things we have around the house. But then on a more serious note, there are these toxic materials that are involved in construction materials. Things like asbestos are still very commonplace around the world. And then importantly for us to bring in is that we mustn't overly separate this outdoor and this indoor conversation, because the Harvard School of Public Health have published some fascinating research which demonstrates that most of our exposure to outdoor air pollution actually occurs when we're inside buildings. So really, we don't want to be creating sealed boxes. We want to be dealing with both at the same time. So in terms of the impacts of air pollution, I'll whip through this very quickly. This is going to be covered very comprehensively by the speakers coming up. But from our perspective, we're focusing on the impacts to people, planet, and also to buildings. In terms of impacts on people, it's now becoming more and more well known through the great work of many of the organizations on the webinar today that air pollution is becoming the greatest risk to human health worldwide, causing 1 in 9 deaths at the moment as an estimation. And there's a breakdown on screen of some of the percentages of different causes of death. But here in the United Kingdom, for example, people are mainly focusing on those softer health effects, but still very impactful, particularly in commercial environments. The fact that indoor air pollution can limit your concentration, can make you susceptible to other illnesses, reduce your productivity, and that often does have a business case impact. In terms of the issues for the planet, we know that greenhouse gases are responsible for the greenhouse effect, or 99% of scientists and people recognize it anyway, but a bit more focused, looking at short-lived climate pollutants in particular. Estimates that are published by the Climate and Clean Air Coalition have shown that they're responsible for 45% of current global warming, which Sandra will speak more to shortly. And then a bit more generally in terms of the environmental issues, but again, we're bringing the focus back to buildings and construction, and some of the environmental damage that comes from the practices that we have in terms of sourcing and manufacturing, transporting materials, and then constructing them on site can be incredibly damaging to our biodiversity and have more localized air pollution issues as well. And then again, that buildings focus, and this is really where we have to come to the forefront in presenting strategies that are worthwhile for our members to consider. But from our perspective, natural ventilation in many climates of the world is one of the best recommendations for being able to suggest ventilation strategies that are good for human health but don't come at a high energy expenditure. But where we have polluted outdoor air, that reduces the feasibility of being able to use these strategies. And so consequently, we have this emissions multiplier effect due to the fact that we need to increase filtration of air. That obviously uses energy. Most of us live in countries where our national grid is not completely clean. And then again, if we're having more extreme temperatures coming, we need to have a heightened demand for cooling coming forward. So that's going to further increase the urban heat island effect in cities. And this just becomes a more spiraling issue. So in my last few minutes, I'll talk about what we're doing on solutions. And our membership is very broad and varied in terms of the membership of the green building councils around the world. So our target is to come up with different solutions for these different stakeholder groups, ranging from the citizen up to the policymakers, but definitely there's a role for business and the health sector to play. But before we can start pursuing these solutions, before we can start working around those 6 areas that I mentioned in the introduction, our awareness and our policy changing and our technical work, we need to be aware of the outdoor and indoor air quality situations that we have around the world. And from the feedback we've had from the majority of our green building councils is that they do not feel adequately equipped with enough high value data that's really localized to their specific area of the world and focused on buildings for them to be able to push through a lot of the advocacy work they would like to do. So the World Green Building Council is kicking off a project now with a number of our partners so that we can try and address this, again, bringing our real buildings focus to a lot of the work that's been done by many of the organizations on the call today. Our theory of change is that we cannot improve what we cannot measure. And so consequently, we have launched a global air quality monitoring campaign called Plant a Sensor. So Plant a Sensor is going to aim to provide universal access to valuable high quality air quality data. This, of course, is very focused around buildings. It's going to be a dual campaign. We're looking at both outdoor and indoor air quality monitoring. And the aim is to ultimately be generating data-driven action towards a sustainable built environment through the collation of data that we have appropriate metadata for. We have faith in its validity, and we have gone through rigorous calibration tests and put together a solid methodology behind it. In terms of the goals of the campaign, really high level, and I can talk about this more in the questions if you wish, but ultimately this is an awareness campaign, both for citizens, researchers, policymakers, but it's also about equipping these people, as well as the academic community, with a rich global data set, and then being able to empower the advocacy conversation by being able to use this data that's really focused on buildings and construction to creating a public health argument for fighting air pollution and climate change. And again, enabling that understanding of the built environment's impact on air pollution. How does it work? So we are looking for participants from all over the world. Anybody can be a participant. You can monitor any building type at all. And we're looking for participants to monitor and publicly disclose their air quality data. This can be done anonymously, but the data is publicly accessible on a platform called Reset Earth. We're working over the next few months to connect with existing air quality monitoring networks that exist around the world. And we're also uniting with our partners at the Earth Day Network to contribute our data towards a wider citizen science campaign that's kicking off as part of the 50th anniversary of Earth Day celebrations next year. So the air quality data will be publicly available on the Reset Earth platform. As I mentioned, this is what it looks like. But I'll close there to keep the time. And if you're interested in this air quality monitoring campaign, we'd be delighted to give you a bit more information. The link that you need is worldgbc.org/plant-a-sensor. You can pop yourself down on the mailing list and you'll be distributed the participant guide, manual, press kit, everything else as it comes to fruition in the next few weeks. So I will stop there, and of course happy to take any questions when we move into the Q&A period, and I greatly look forward to hearing from the rest of the presenters on the webinar today. And it gives me great pleasure now to hand over to Sandra Cavalieri, who is the Urban Health Initiative Coordinator at the Climate and Clean Air Coalition. Sandra, thank you very much, and over to you.
Thank you so much, Katrina, and welcome to everybody on this webinar. We appreciate you participating. I'm just waiting for my slide. Okay. My name is Sandra Cavalieri. Again, I work for the Climate and Clean Air Coalition, where I am the coordinator for our health initiative. And I work closely with the World Health Organization, UN Environment Program, and World Bank on a joint campaign called Breathe Life, aimed to mobilize cities, regions, and national governments to reduce air pollution and protect our health and slow the rate of climate change. The leadership, policy, and technical work of the World Health Organization and UN Environment and to engage these cities in helping them to achieve their WHO air quality guidelines by 2030, having the number of air pollution related deaths by 2030, and slowing the pace of climate change by 0.5 degrees Celsius by 2050. And Breathe Life combines public health and climate change expertise with guidance on implementing solutions to air pollution in support of the Sustainable Development Goals. We officially launched Breathe Life in 2016, and we're promoting solutions to reduce short-lived climate pollutants that Katrina mentioned, especially black carbon, methane, and tropospheric ozone. So today I will introduce the problem of air pollution, its impacts, and the theory of change behind Breathe Life, and share some recent success stories. So many of you are probably well aware, but according to the World Health Organization, every year air pollution causes 7 million premature deaths. And of this, 600,000 are children under the age of 5. Air pollution at the moment is responsible for 29% of deaths from lung cancer, 24% of deaths from stroke, 25% of deaths from heart disease, and 43% of deaths from lung disease. And children are one of the most vulnerable groups that are disproportionately impacted by air pollution. And I want to draw your attention to a WHO report on air pollution and children's health released in October 2018, which revealed that when pregnant women are exposed to polluted air, they are more likely to give birth prematurely and have small, low birth weight children. Air pollution also impacts neurological development and cognitive ability and can trigger asthma and childhood cancer. And children who have been exposed to high levels of air pollution may be at a greater risk for chronic diseases, such as cardiovascular disease later in life. And so through Breathe Life, we're really trying to share the information developed by the World Health Organization in particular on the health impacts of air pollution. But it's not only health impacts, it's also impacts on climate change, on rainfall patterns, on energy consumption and global crop yields. And according to the World Bank, air pollution is costing the global economy an estimated 5.11 trillion in welfare losses. And in the 15 countries with the highest greenhouse gas emissions, the health impacts of air pollution are estimated to cost more than 4% of GDP. Meeting the Paris Agreement on climate change, however, could save over 1 million lives a year by 2050 and yield health benefits worth an estimated 54.1 trillion. So about twice the cost of mitigation through reduced air pollution alone. As was mentioned, and again, the Climate and Clean Air Coalition is really developed to address short-lived climate pollutants. Short-lived climate pollutants are at the nexus of climate and health. And in particular, black carbon is the main component of PM 2.5, which is the most health harmful air pollutant. And so I really encourage those who are just learning about short-lived climate pollutants now to delve a bit deeper into our website and information about short-lived climate pollutants, which again are the largest contributors to global warming after carbon dioxide. They're responsible for up to 45% of global warming, again contributing to the 7 million annual premature deaths from air pollution and causing 110 million tons of crop loss each year. And so fast action to reduce these pollutants will yield multiple benefits. So I mentioned meeting the Paris Agreement, and in the recent IPCC 2018 report, it warns that there's still a long way to go if we want to limit global temperature rise to 1.5 degrees Celsius. And it also shows that there are ready-to-go solutions that can help us achieve this target while rapidly reducing the rate of warming and preventing millions of premature deaths from air pollution each year. So this requires the world to go on a path to reducing short-lived climate pollutants at the same carbon dioxide are reduced. And this is probably my favorite graph, and really the signature story from the Climate and Clean Air Coalition. It shows the safest path to 1.5 degrees is taking early action on both long-lived and greenhouse gases, long-lived greenhouse gases and short-lived climate pollutants, the lower green line on the graph. And this is also showing that if we take action now, we're able to slow the rate of warming, which is really critical. Because if we decide in 2050 that we want to start addressing short-lived climate pollutants, the curve, the warming will have already increased so dramatically that reducing short-lived climate pollutants will not be nearly as effective and may not be effective at all if we don't, to the extent that it could be today if we take action now. So it's really a window of time, and now is really the moment. So through the Breathe Life campaign, we're not only trying to raise awareness about the impacts of air pollution, but also about the solutions. And so I really encourage you to go to our website where we have information really drawn very heavily from a 2015 WHO CCAC report on the best solutions that would have the best impacts for health, climate, and air pollution. And in the interest of time, I'm going to move from here, but I encourage you to have a look and look at these solutions, and also to go back to the original report, which is extremely helpful in explaining how all of these solutions integrate. So for today, of course, the focus is on green buildings, and this is a really important point. Better building design can reduce the demand for energy from fossil fuels and also air conditioning, which is a key source of HFCs. And so working to improve building design by using higher quality materials and following passive design principles, as we said, can reduce the energy demand, but also it will reduce the need for energy from fossil fuels, which will reduce short-lived climate pollutants and long-lived climate pollutants, and also hopefully the need for air conditioning, which is, as I just mentioned, a major source of HFCs. It also can reduce disease associated with poor housing. So there's also disease, in addition, addressed to mold and dampness and infections that spread as a result of poor ventilation. So there's a whole host of health benefits from green building design. So we have developed through Breathe Life, in addition to raising the awareness about the health and climate impacts, we have brought governments on board who are aspiring to reach WHO air quality guidelines. And we now have a network of more than 70 cities, regions, and countries, reaching over 288 million citizens. Also, at the recent UN Secretary General's Climate Action Summit, an additional 48 countries and 78 subnational governments signed up to commit to integrating climate and air policy by 2030 to meet WHO air quality guidelines. And in a very exciting even more recent development, at the C40 Mayors Summit, 35 cities signed a Clean Air Declaration, which includes a commitment to achieving WHO air quality guidelines by 2030. And also with the World Green Building Council, we're reaching this network of more than 70 countries worldwide with this information and this on this specific sector as a solution to help achieve these WHO air quality guidelines. So thank you very much for your attention today. In closing, just to reiterate that green building design is one of the major solutions, especially in urban areas where over 80% of urban residents are exposed to air pollution levels that exceed the WHO limits. Very happy to further this discussion after the webinar. If you would like to send me an email, my information is there. And now I would like to kindly turn over to Pier Paolo Mudo, who's the researcher from the World Health Organization, who will go into more detail on the health benefits from the green building design and urban planning.
Hello, everyone, and good morning, good afternoon, good evening. Thanks, Sandra, for introducing the issue. Also, Katrina, for introducing a lot of different topics. I have a presentation that is divided in three simple sections. The first section is on the WHO, the World Health Organization, work on green spaces, and in particular, I will give you some more detailed information about the work done on green space and air pollution. The second point is how we can move from having information and knowledge on the impact of green space on reducing or affecting air pollution levels. So how can we assess this? How can we quantify this operationally? And third, I will conclude with some notes that I think are important within our area of work. The first thing that I just want to give you is an overview, a very quick overview of a long-term work that has been carried out by the World Health Organization on green spaces. The work that is done in green spaces is not different from other environmental risk factors. So we have expert meetings, we have the need to accumulate and to analyze the evidence, and we usually we have people running systematic reviews for us, meta-analysis, or we use the literature that has been published. We summarize the work sometimes with reports, and in few cases we also develop tools, and this is one of the cases where we can discuss also the existence of tools and what the World Health Organization is doing in this area. And also seldom we also run case studies, and Sandra was mentioning the Urban Health Initiative, and I will show you very quickly and briefly some example of work that we are doing in the field. The first thing that I want to tell you is that it's very important that there's been a huge increase of work and by the scientific community in the last, I would say, 6-7 years. There's a paper in which there was a big, the number of papers that are being published on green space and socioeconomic effects and also health effects has been skyrocketing basically in the last 15 years, but in particular after 2012, 2013, there's a lot of materials, so there's a lot of documents that now can give us a clear picture about what's happening when people are living in proximity of green spaces or they're living in absence, for example, of green spaces. We are at the moment going to publish a systematic review and meta-analysis of longitudinal studies related to the effects on health of green spaces. And for effects on health, and I will repeat this later, we are focusing on all mortality and cause-specific mortality, for example, cardiovascular mortality, but we can go on this more in detail if you want later also. The other thing that we are involved is we are supporting a systematic review of the quality of green space, so the characteristics of green spaces, of natural spaces, and mental health and well-being. Mental health is probably one of the strongest effects that green spaces have on our health. So that's a huge effort in our case. In the last year and a half, I've been following these activities, and while for green spaces and mortality, we had just I think 7,000, 8,000 papers to scrutinize. And then we ended up with 11 papers. In the case, for example, of the influence of the characteristics of green spaces and mental health, we had to start from, if I'm not wrong, 20,000 papers. This is a huge work where we need to have networks of experts working with us. The other thing that I was mentioning is the fact that we try to summarize what is the state of art and what are the main issues that are related to a risk factors. In this case, it's not a risk factor, but it's a beneficial factor in most of the cases for health, that is green space. And we have published in 2016 two reports, one on the urban green spaces and health, that is just a review of the evidence. And 2016, even if it is 3 years ago, it still give you an idea of how the agenda, scientific agenda was moving. And now in the last 3 years, a lot has been published. The other point is that it is very important not just to I would say end our efforts just to review the evidence and give people the evidence, but it's very important to have a dialogue with all the people that are implementing interventions and they are affecting policies. And that's why we have published also a short report on the urban green space interventions. The other work that we have been doing with a colleague of mine, Matthias Braubach, in the last 2 years has been on the planning. So how urban green spaces can be planned in a way that I would say in an intersectoral work can be pivotal in addressing something that so far has been very neglected in most of our cities. So how to approach the planning, how to design urban green spaces, and how to promote their use. So these are some of the characteristics of the work that we have been doing in terms of reporting. I think what you are interested more is probably the what to do with all this science, with all this information, with all this knowledge. And the US EPA has a very nice tool that is called I3 that is very interesting because you can model literally very well and with a very good series of detail what's happening when you have an intervention of green space in your place. I3 is a very complex system. It's a very complex software, and we have been discussing a lot with our counterparts that are public health people most of the times, people that are quite scared to embark themselves in working with a quite complicated environmental modeling. And a few years ago, we decided to start thinking about having a simple tool that could allow people to go from having some measures of exposure to green space, so basically living in proximity of green space, and having the health impacts that are related to this exposure. To cut it short, we have then started working on a software that is working with a GIS, with QGIS, that is an open source GIS. And the idea is that we have had a series of expert meetings where various experts from all over the world has given suggestions about where to start working with, what are the priorities. And there are three main areas where we work. One is related to just the exposure, so being in proximity of green space, and that can be have a lot of all-cause mortality impacts, cardiovascular mortality impact. But then you can have other effects that are mediated by, for example, ecosystem services. and this is probably the part that you are interested more, because air pollution is one of these, is within this part. And the last block is on the possibility, the opportunities to foster active transport. And this is the third block of the idea of this kind of work. And with this, we have decided to build this a tool for green space, because this will fit within a family of tools that we have been developing in the last years. One is RQ, that is a tool that since 20 years that we are using, and it's a very simple tool to calculate the health impacts of air pollution. Then 10 years ago, we developed a tool that is related to the health and economic assessment of cycling and walking. So the idea of having something related to land use, in this case of green space, something that is fitting a series of tools that we have been working with. And the last one, the latest one, is a carbon reduction tool, and another one is also on the pipeline that is on transport. With this in mind, we have started working on the idea of allowing people that have a very, very limited knowledge with GIS to understand what is the complexity and how to deal with the complexity of having measures of green space, and then relate this green space measure to health impacts. In few words, in reality, what you need is to have basically an area, a region, a city, or a country, whatever it is, and then you need to have green space defined in a way or in another with a map, and this can be retrieved even from open source sources like OpenStreetMap, or you can have a satellite data, or you can have other shape files from your authorities. But the idea is that once you have an area well delimited, you have your population living in this area, you have your green space, then you can start building some scenarios, like what if I add some green space in this city, and what if I reduce the green space in this city, and what is the impact of green space through ecosystem services. So this is the idea of the work that we have been doing on putting the science that has been accumulating so far, with the idea that we need to have more people being able to work with this kind of estimates. And it's not only just to provide a tool for people to planning, but also it's educational, because once you start discussing, for example, what is the definition of green space, then you will see that there were a lot of different cultural differences all over the world and in many different places. I go on now with this slide directly to the point that how do we deal with the quantification of the effects of green space on health through air pollution? We can do it in two different ways. One way is to say, okay, we are in a city, we are in a place where we have some levels of air pollution. We have an average level, I don't know, can be seasonal, can be for a year, so yearly levels of air pollution. And then we see how much of our green space is contributing to an abatement of air pollution. So what if the green space that we have would not be present in the place? And then we can have a second way to deal with green space and air pollution is through watching carefully what's happening in different sectors. The main responsible usually are industries, or can be transport and traffic. So then you can model what happens if you add green space close to highways, and what if you surround a factory with green space. So you can start thinking about the local sources of green space. And once you do this, basically you produce a percentage, a reduction of emissions, or an increase of emissions if you have a reduction of green space, that can be used to make calculations for the health impacts that are related to to this different air pollution situation. And the health impacts are or can be long-term or can be short-term. Long-term effects are usually on mortality or cause-specific mortality outcomes, while short-term effects are usually measured with hospital admissions data, for example, for cardiovascular disease or for respiratory diseases. In the Urban Health Initiative, we have had the privilege and the possibility to work in 2 cities, in particular in Accra. And the situation of Accra is a not typical situation for Africa, because there's no typical situation for Africa, but a typical situation of a West Africa city where you have a lot of exposure also related to desert dust. And you have, as this is quite trendy in Africa, a lot of emphasis on planting trees, on changing the land use and landscape of the city. You know that in Ethiopia in July, during one day, I think 29th of July, they have planted 350 million trees. And in Nigeria, I think there is a 12 million trees plan. In Accra, there's maybe the more modest plan to have 21 new parks. So we started a discussion with the local stakeholders there, and there was a lot of interest in understanding also the role of green space. And we did a work on waste, on solid waste management, and we try to see what happens when you replace landfills and dump sites with urban parks. And this is something that, as an activity, that now is really going on in these days. And we have finalized the first round of analysis, and now we are asking for feedback from local partners. And the other work is on what if we have a lot of air pollution that is related to transport, and what if we model the green space reduction of the traffic. And this is also another sector that is quite heavy in Accra. And I'll show you a couple of pictures about the possibility of running this kind of analysis. These data analysis are quite time consuming in order to get data. It's not easy to get all kind of network data, all kind of air pollution data. But I'm giving you just an example about the total removal in the built-up area of the green space that is in Accra, in the center of Accra. These are the main districts in the center. And Accra is a city that in itself has almost 2 million inhabitants, and the greater Accra metropolitan area is 4 million inhabitants. So numbers matter, and I can go, I think, to the conclusions. First of all, there are still many gaps that need to be filled in the connection between green space and health. And there's a huge debate about how much, for example, green spaces provide ecosystem services for the air pollution. For example, for the air pollutants, we know very well that is important ventilation. We know very well that is important the health of trees. So we are now in a much better position compared to the past. But evidence is becoming quite consistent about the possibility to have a passive reduction due to just the existence of a well-designed green space in a city. The other thing is that air pollution mitigation strategies are very important for public health people, and not only for public health people, but also for the people working in environmental issues, to open a broader discuss about the design and the land use of a city. And Sandra, and before there was Katrina were mentioning climate change issues. So the air pollutants are not only responsible for pollution, but also for climate change issues. And the other thing is that through air pollution, we can move also to the discussion to other urban green spaces health effects that are quite important. What we know is that overall, green space, if you remember, I just show you very quickly the graph with all the different possibilities that you have when you're modeling green space and health. But in reality, what happens is that for each box where you have a relation between green space and health, you have very small impacts on health. But if you put together all these small impacts, you get quite important effects in a city. And in any case, I was mentioning Accra, small reduction in cities that are quite big with big populations are not negligible in terms of health impacts. And just to conclude with the last point, it's important to think about the new strategies for environment and health at the urban level. And public health and thinking about what we are, how the way our cities are designed and their impacts on health is something that can really change all our strategies, and it can also involve much more participatory mechanisms. And I think I would say also much better results and outcomes from our policies. Thank you very much.
Thank you, Pier Paolo. That was really fantastically interesting. Thank you for sharing all of that, and I'm sure there'll be many questions for you when we get to the Q&A. I am pleased now to hand over to Dang Espita Casanova, who is the Senior Air Quality Program Coordinator at Clean Air Asia.
Hi. Yes, thank you, Katrina. Good morning, good afternoon, and good evening to everyone online, and thank you for your participation. I'd also like to thank the previous speakers for setting the scene and sharing different tools and knowledge that are already available for our stakeholders to understand better the air pollution crisis, its impacts, and what are the solutions that we can do to mitigate its impacts. So I will be presenting one of our approaches in the work that we do with the cities. It is to mainstream air quality and climate measures in urban development through action planning. So since the previous presenters already provided comprehensive information on tools available and methods, so I will focus my presentation on the approach and the practice of the work that we do with cities in the region. So a bit of a background for everyone. Clean Air Asia is an international NGO working on air quality, climate change, and related issues in the region. We are an UN-recognized partnership with more than 250 organizations in our network, and with 7 country networks in Indonesia, Malaysia, Nepal, Pakistan, the Philippines, Sri Lanka, and Vietnam. Our vision is Asia without air pollution, and we reduce air pollution in GHG emissions in the region by informing stakeholders about air pollution, its links to climate change and sustainability, by building capacity of national and local governments as well as other stakeholder groups, by advocating for the development and implementation of effective and appropriate policies and practices, and by disseminating data and knowledge. Sorry. So it is known that the urban population of the world has grown rapidly from 751 million in 1950 to about 4.2 billion in 2018. And cities have become the centers of innovation and development, but also have become hotspots of air pollution, noise pollution, heat islands, and the lack of green spaces have actually led to reduced physical activity of citizens in Asian cities. So in between 2016 and 2030, sorry, let me just go back a couple of slides. Between 2016 and 2030, the number of cities in Asia with 500,000 inhabitants or more is expected to rise to 30%. And this trajectory makes it imperative or necessary for cities to meet national ambient air quality standards and ultimately WHO air quality guideline values. So the problem or the extent of air pollution impacts have been broadly described earlier, and we wanted to curb that impact by helping cities in Asia and equipping them with solutions in terms of mitigating air pollution impacts as well as complying to this air quality standards and guideline values. So, unfortunately, in an analysis done by Cleaner Asia in 2018, in 419 cities in Asia, 6 out of 10 developing cities still exceed the WHO interim target 1 for PM2.5, which means that the annual average of PM2.5 remained to be around 40 micrograms per cubic meters, and that the developing majority of developing cities in Asia still inhale air that is harmful to their health. So to achieve compliance and mitigate adverse impacts on health, environment, and economy, as well as overall urban development, it is necessary that environmental pollution, including air pollution, is considered in development planning, particularly in the process of clean air action planning for cities. Now, what is a clean air action plan? A clean air action plan is a plan which outlines mitigation strategies which addresses health and environmental impacts of air pollution, and it lists as well the roles of stakeholders that are involved in the development of the cleaner action plan and its implementation. Now, we emphasize that the cleaner action plan must evolve through an integrated air quality management framework with other sectors in the local development actively involved, such as power and energy, transportation, urban development, as well as sustainable urban mobility. So in order for a cleaner action plan to be effective, we emphasize in our work that it is important to engage the proper stakeholders at the onset of the cleaner action planning process. This way, we are ensured that sustainability of the cleaner action plan implementation is allocated proper resources in terms of financial as well as technical manpower. So, next slide. So, the approach of cleaner action planning enables the setting of air quality objectives to reduce health, environment, and other impacts of air pollution, but also considering other urban development priorities. Now, in the process, it is also, climate co-benefits can also be realized. And this is undertaken to avoid limited progress, which is seen in efforts to maximize air pollutant and GHG emissions co-benefits in air pollution policies, which are actually in most cities in Asia are not integrated or considered in other sectoral plans. Now, what happens is that this leads to piecemeal results of emission reduction efforts and limits the co-benefits potential that may be realized in targeting both air pollutant and GHG emissions. Now, in cleaner action planning, cities also have to consider, of course, the costs the type of the governance or the form of governance that the cities have, because this will of course ensure that political will and support to implement the cleaner action plan is in place. And of course, on the solution side, what are the available technologies that can be adopted by the city? Next slide, please. So the Cleaner Action Plan identifies sources of air pollution that are within the direct control of or are capable of being influenced by the local or the city governments. Now, the process, as I've mentioned earlier, hence leverages the strategic engagement of different local government units, including urban planning, transport, health sector, among others. And this will, of course, enable the mobilization of resources in the most effective and efficient manner to achieve the set air quality objectives. Now, the Cleaner Action Plan development process is iterative. It begins with defining air quality objectives. What is the vision of the city in the short, medium, and the long term to achieve in terms of air quality or improvements? And it is followed by establishing a robust and science-based baselining, because of course we recognize that, as Katrina said earlier, that we cannot improve what we cannot measure. So we want to have that robust knowledge base in place to start the cleaner action planning process. And then it ends with a process of review and improvement, wherein the process is evaluated to determine the effectiveness of the measures that has been set out and implemented, and to determine if there are actual changes that needed to be implemented to achieve greater emission reduction, to address excessive costs, or amend measures as appropriate. Next slide, please. So to give you a bit of a flavor of the work that we do at the city level, so Cleaner Asia supported the cleaner action planning process for Marikina City, one of the cities which comprise the metropolitan Manila region in the Philippines. It is one of the Breathe Life cities that was launched earlier this year by CCC, WH, and WHO. And the approach entailed the support and participation of different stakeholders from the private sector, the government, the academe, as well as NGOs alike. So we want to ensure that all considerations in development planning are considered. So the approach looked into current development and priority thrusts of Marikina City to determine entry points where we could align and implement air quality and climate measures. Next slide, please. So the cleaner action planning process that we employed was done through a comprehensive assessment. At the first stage, was done through a comprehensive assessment of the status of air quality in the city, the main emission sources, health impacts, as well as preliminary assessment of health impacts of air pollution. So we also looked into assessment of the air quality management capacity of the local agency, which is the City Environment Management Office, of their capacity of managing air pollution and climate change. So this was done through partnership and collaboration with the agencies and organizations listed below, but I wanted to highlight that the whole process was supported by a rigorous stakeholder consultation process. So this was from the onset. So we formed a core group of working organizations who spearheaded the action planning process, up to the prioritization of measures which are all aligned with the development priorities of the city. So next slide, please. So we also wanted to emphasize that part of the cleaner action planning process for Marikina was the assessment of green spaces, existing green spaces in the city. So this was conducted through collaboration with the Ateneo de Manila School Environmental Science Department, where students used handheld sensors or air quality monitors to compare the ambient air quality inside the green spaces and within the immediate boundaries. So preliminary results show that PM 2.5 levels go higher as the measurements come from the center of the green spaces to the outskirts, and especially towards the main thoroughfares. Now, the results from this monitoring was incorporated in the formulation of measures in the Cleaner Action Plan, and hopefully would provide rationalization or justify the need to establish more green spaces in the city in order to improve air quality and also to encourage the citizens of Marikina City to lessen their exposure to ambient air pollution. So next slide, please. This results was justified or supported by the emissions inventory we did for Marikina, where in fact mobile sources contributed the largest fraction of criteria air pollutants as well as NMVOCs to the air quality or air pollution problem. Now, next slide. Um, After the rigorous and science-based assessment that we did for Marikina, so we came up with a map of PM 2.5 hotspots and vulnerable locations in the city. So we coupled this with air quality monitoring, both mobile and stationary, emissions inventory, a preliminary health impact assessment, which you can see at the right part of your screen, where we mapped health incidences of acute nasopharyngitis and other diseases that are closely linked to air pollution. So here, what we wanted to demonstrate was that indeed, when urban planning or urban development planning is underway or currently one of the thrusts of cities like Marikina City, we wanted to emphasize that local policymakers have to consider vulnerable locations such as elementary schools, hospitals, etc., in crafting their, for example, traffic management policies or building or development infrastructure policies. So as you can see in our results, indeed, in the hotspots that we identified, there are vulnerable infrastructures or infrastructures with vulnerable populations in them. So these results we synthesized in the Cleaner Action Plan, which we hope to be addressed in the city's development planning in the next 5 to 10 years or so. We wanted to also emphasize that for example, the green spaces under study were close to hotspots of PM 2.5. So this also would inform the policymakers that measures should be taken to immediately mitigate the exposure of citizens in this in vicinity surrounding the green spaces. So next slide, please. I'd like to wrap up my presentation, but by underlining that Cleaner Action Plan does not stop at the development of the plan, but we want to ensure that its implementation is meticulously threaded into the planning and other operational processes of the city. So as I've mentioned earlier, the creation of a core group for the cleaner action planning is important. And in the case of some cities in Asia, it works when an executive order from the top executive of the mayor is issued so as to institutionalize a cleaner action plan. And most importantly, I think with the set objectives that we have at the onset of cleaner action planning, we have this process of review and evaluation every 3 to 5 years, whether to see that the measures are still applicable and effective as we intend them to be. So I'd like to end my presentation. Next slide, please. So with a few key messages, and that with the current trend or trajectory of urbanization in Asia, we want to be able to help cities to continuously mitigate health and other impacts of air pollution. And we do this by allowing them to, or building their capacity to develop their cleaner action plans that are integrated into their overall development planning. And that, of course, green spaces and green infrastructure play an important role as to providing solutions how we can avoid detrimental impacts of air pollution. So thank you, and for questions or clarifications, would be happy to discuss later in the Q&A or through email. So thank you, everyone.
Thank you so much, Dang. I really appreciate your presentation, and also all of the work that Clean Air Asia is doing directly with cities on the ground to really scale up the implementation that's needed. Now we're going to turn to Martin Schneekloff, from the policy officer from the Clean Air Unit, the European Commission. And this will be the final presentation before the Q&A. So thank you very much, Martin. I'm looking forward to your presentation.
Thank you very much, and good afternoon, everybody. As was said, I'm Martin Schneekloff. I work in the Clean Air Unit in the General Directorate for Environment in the European Commission in Brussels. And I'd like to thank you for the opportunity to talk today about the EU perspective on air pollution agenda. I will try to provide an overview of why we see air pollution as a problem, what the EU does to solve it, and then finish with some thoughts about the next steps. Even though there's not much we can say at this point in time because of the transition phase between the old Commission and the new Commission. But I will say some of this as well. Next slide. And the next one. So air pollution is not a new problem in the EU either, but the awareness of effects of air pollution and the urgency to address them has increased remarkably in the last years among the EU populations. And as a consequence, air pollution is high on the political agenda of the European institutions and the authorities in the member states as well. Next slide. So the EU and the member states have had legislation in place for air pollution for many years now. And the good news is that these measures are working, emissions are decreasing, and so are the impacts. So as you can see, while since 2000 the GDP has been rising by to 127% compared to the starting point. There's been a decrease in the major pollutants, more so for some pollutants than others. Especially SO2 has seen a very remarkable decrease, but less so with ammonia. And there's also been a tendency that the trend has been leveling off in the last years, and maybe perhaps a slight increase for some pollutants such as ammonia perhaps Endenburg as well. We see the same picture for the exposure to urban populations in the EU in the same time period. Next slide, please. So with this decrease in emissions, you could perhaps ask yourself whether air pollution is still a problem in Europe, which it is. The news report from the European Environmental Agency number 10/2019, it just came out, and it's called Air Quality in Europe 2019 report. Shows that still more than 400,000 premature deaths every year is resulted from air pollution, including around 274,000 premature deaths related to PM2.5, and 17% of all lung cancer deaths in the EU are due to air pollution. And citizens are exposed to persistent exceedances in most member states. There are also very significant economic costs that follow from this. It's been estimated that there are more than 20 billion euros per year in direct costs, and between 330 billion euros to 940 billion euros per year in indirect costs. Moreover, there are very significant environmental impacts from this, as it seems that eutrophication limits have been exceeded in around 62% of the European ecosystems, and in 73% of the Natura 2000 area. And for those of you who are not familiar with European legislation, the Natura 2000 areas are protected areas in the Habitat Directive, which is the main biodiversity legislation of the EU. Moreover, also we have a very significant impact on the cultural heritage. A recent study carried out by the LERTAP Convention showed that from 16 World Heritage sites that were monitored, they found, I think, a cost of 7 million euros per year to maintain these because of the air pollution. Next slide, please. Yes, and this health challenge is especially high when you look at it from the point of the WHO air quality guidelines. When you look at it from the EU standards, the picture is much better. But when you look at it from the point of where air pollutants do not have negative impacts on human health, it is a much different picture. It's most of the European populations are actually exposed to dangerous levels of ozone. BAP is also a big problem, as are PM2.5. Next slide. And the problem is not evenly distributed in the EU. It depends on the activity, and it also depends on the pollutant we're talking about. So you can see that for example, here for PM10, this problem is especially high in Poland and northern Italy because of industry and domestic heating, whereas a pollutant such as NO2, which is connected to high traffic density, that problem is especially high in, for example, Germany. Next slide, please. So as a step towards achieving the levels of air pollution that are not harmful to humans, the EU aims to halve health impacts by 2030. And the EU tries to do that through having a policy framework in place, provide funding, and carry out enforcement actions, and by giving implementation support to the member states. Next slide, please. The EU policy framework consists of both setting objectives for good air quality and reducing emissions of pollutants. And we have the ambient air quality directives in place, which have set maximum concentrations of 11 air pollutant substances. And we have a directive called the National Emission Ceilings Directive, which set national emission totals for 5 substances, as well as an EU total for all sources combined in the member states and the EU total. And it's up to the authorities in the member states to choose the actions that are needed to comply with these reduction targets. And of course, urban green infrastructure can be one tool that they can apply if they wish so. And as tools to achieve these concentrations and the reduction targets, there are a range of source-specific emission standards in place in the Industrial Emissions Directive, for example, in the Medium Combustion Plants Directive, the Eco-Design Directives, and the Directive on rules on energy efficiency and the standards for fuel. Next, please. In terms of funding, we in the cohesion policy, we have the Regional Development Fund and the Cohesion Fund. Here we have a specific allocation for air quality around 1.8 billion euros for the period 2014 to 2020. And in addition, there's also indirect contributions here to air quality through other policy areas like the low carbon economy, resource efficiency, and network infrastructure. The LIFE funding mechanism of the EU offers a further 300 million euros for integrated projects and preparatory projects. And the European Fund for Strategic Investments has quite a pot of money as well, of which 30% have possible air quality links. And the research program Horizon 2020 also has indirect benefits for emissions reductions. Of course, the multi-annual financial framework for the new period the negotiations on this is not finalized. So what this will be in the future, we don't know yet, but this is to be seen. Next slide, please. Of course, the rules in place have to be enforced, and compliance gaps do exist. It is mainly, for the time being, for the ambient air quality directive, as the new NEC directive the 2020 targets in this and the 2030 targets have not, of course, not relevant to evaluate yet. So we will see how member states do when we come to this. But so far, for this point in time, the enforcement action is mainly related to the ambient air quality directive. We have already 2 rulings by the Court of Justice of the EU. 11 cases have been referred to court, and we have 32 cases in total. And for those of you who listen who are not from Europe, maybe I can explain a bit that this process is a very long process. It's starting with perhaps a pilot letter asking the member states what's up and down, what they've been doing, and then there will be a reply from the member states. If that is not satisfactory, there will be a formal letter of formal notice being sent. There will be a new round of questions and dialogue with the member states. If it's still not satisfactory, then a reasoned opinion will be sent. And if the legislation is still not complied with, then the case will be referred to the Court of Justice. And of course, this can take a long time. And you can see here how the enforcement action is where the main problems are. It's mainly in relation to NO2 and to PM10. Next slide, please. The EU also tries to help the member states by giving implementation support. There's a formal process called the Environmental Implementation Review Dialogues, which is covering all member states. There's tools and funds in place to help dialogue between member states in a peer-to-peer exchange. And member states can also request a dialogue with the Commission directly about the specific problems of that particular member state with the Commission, and so far 7 member states have done so. And we have also high-level events called the Clean Air Forums in place, where there will be the second forum will take place in next month in November. And then there are initiatives to bring regions and cities together and discuss between and across levels in the member states. Next slide, please. I think we already had that one, so next slide, please. Yeah. So some concluding reflections from my side. So the Commission has emphasized an urgent need to improve air quality through full implementation of the ambient air quality directives and the NEC directive, and compliance gaps do remain. And we do continue to support implementation by member states. And we have an ongoing fitness check of the ambient air quality directive, which is seeking to understand what works well and what could work better, to see whether these directives are fit for purpose. There's also an evaluation report of the NEC directive implementation coming up in April next year at the latest, and this will provide a basis for the further implementation of the NEC directive. I can also mention that work will have to be done on biodiversity as a preparation for the Convention on Biological Diversity, which takes place October next year, and there will seem to be a follow-up, an action plan to follow up that after. So also here, green urban infrastructure could be, I suppose, relevant to look at. And that is it from me. Thank you very much.
Thank you very much, Martin. Thank you all. Very interesting talks. I know we've run over time, but it was worth it in my opinion, and I didn't want to disturb any of you. For those of you that are still joining us, if you wish to set a question, we will have maybe 5 minutes of questions. We'll do a very rapid, fast round. So in the text box, you can send a question to us. Perhaps I'll just have a quick one to all of you, and the order of who spoke, from Katrina to start to Martin at the end, just very briefly. I noticed a common trend in the discussion. Sustainable Development Goals were mentioned, and even Martin at the end mentioned 2030, which aligns with the Sustainable Goal targets. How strong a role are the SDGs in the ambitions that you're all trying to achieve respectively, and how are they feeding into the strategies going forward? Katrina, could I start with you?
Sure, thank you. And I think that's a great question because for us, as I mentioned, the World Green Building Council is a membership organisation. So we act for our members, but also to reflect the actions and priorities of our members. And 2020 is a new strategic period for us. Our strategy rolls in 3-year cycles. And for the last year, we've been doing a lot of research, both internally about which SDGs we should align to, but also externally within our membership about how comprehensively people are looking at the SDGs. And what we found is that the vast majority of our members, both the Green Building Councils and their members, are going to extensive efforts to align with the SDGs themselves. Now, a lot of our members are private sector organisations, but there's also elements of academia, of different public organisations, other NGOs, and I think what we've noticed is that there's been this very big transition between just looking at green buildings and the focus being green environment, net zero climate action, to suddenly this much more holistic approach to sustainability. And people want to see green, but they want to see healthy, they want to see circularity at the same time. So that really is the fundamental component for our next 3-year strategy. And I'll be interested to hear what the rest of the panelists say.
So thanks so much. So this is Sandra Cavalieri, and I can say from the Climate and Clean Air Coalition's perspective, we have aligned very closely with the SDGs and have done analysis of how mitigating short-lived climate pollutants will help to achieve many of the various different SDGs. This is also true for Breathe Life, that the solutions that we're promoting are going to benefit each of the SDGs in a slightly different way. So without going into too much detail, I will direct you, I'm going to put into the question box, I'll direct you to the Climate and Clean Air Coalition website where we have a bit of analysis of this already done.
Thank you. Pier Paolo, do you have anything to add?
Yes, WHO is the custodial agency for the SDG, the indicator 3.9 on reducing the number of deaths from air pollution by 2030, and then also for the indicator that is on the 7.1, if I'm not wrong, on the proportion of the population with a reliance on clean fuels and technology. And also we have another indicator that we are the custodial agency, so we produce the official data for the SDG that is on the 11 on annual mean levels of PM in cities. But my work, what I was presenting, is also related to the target of 11.7 of the SDG on cities, that is to provide universal access to safe and accessible green spaces, green and public spaces. So our goals and our work is really oriented by the SDGs, and I think there are an opportunity not only for us but also for other agencies, and from what has been mentioned, for a lot of inter-institutional work and work with stakeholders. I mean, there are really a big opportunity for also for fundraising and for discussions.
Thank you. Dang, do you have anything to add to that?
Yes, I just wanted to highlight that the work we do at Cleaner Asia, specifically on strategic air quality management framework, so the guidance framework for better air quality in Asian cities, which in its development needs of governments in Asia, both at the national, particularly SDGs on health, on sustainable cities, as well as climate change. And as we implement our work, we also work with organizations like the UN Environment, WHO, CCAC, which of course uphold the SDGs and also involve in national and local level action planning, which promote the implementation of SDGs in policies and capacity building.
Thank you. And Martin, just to close, I suppose you mentioned, it was you that mentioned the year 2030. I'm guessing it's no coincidence that it aligns with the SDGs.
No, well, of course, we're in a transition phase now between two administrations, but the sustainability goals have been very essential to this commission, and they figure very prominently in the mission letters from von der Leyen to the incoming commissioners. And of course, we'll have to see what the incoming commission wants to do, but it seems like they will be essential to this commission, to the incoming commission as well.
Okay, great, thank you. I know time has gone by, and I think we haven't had any direct questions, probably because maybe everybody has to run off. One thing I noted, though, that a word that Dang highlighted was the word integrated and integration, and I think all of you have presented the role of different stakeholders, and it's not an individual's perspective in terms of developing any sort of plan or policy. I'm very quickly going around everyone just for a last comment on the general overview of what next, and then we'll come to a close. Katrina, start with you, just very briefly, a few seconds to kind of make a closing statement.
Sure. For us, monitoring first, data accumulation, and then advocacy.
Thank you.
Yeah, so from our side, we're really focused on raising awareness and then promoting specific solutions to mitigate air pollution, specifically short-lived climate pollutants.
I think there is the need to start doing very structural interventions and to build green and sustainable cities. We are too late for some aspects, so we need to do things very quickly, and particularly in some areas of the world, in low middle-income countries, the situation is quite serious.
Yeah, so for Cleaner Asia, it's always our thrust to, of course, build the knowledge base and assess the specific needs of the governments that we work with, and at the same time, building the capacity to implement solutions and measures on air quality and climate change.
And I'm going to take a word for us, of course, the upcoming negotiations in the LERTAP Convention on the long-range transboundary air pollution are important right now, and so is the implementation support and the enforcement action.
Okay, thank you very much all. I really appreciate your comments. If anyone of our attendees couldn't ask a question or wants you to follow up, please, you can contact me or directly, and I can maybe pass it on to the speakers if they haven't provided details. But you're more than welcome to ask any questions directly to myself. And thank you very much to all of you for joining. It's been fascinating to hear kind of top-down initiatives, programs in the making, and exposed in the case of maybe the European Commission in the next iteration in terms of what you're doing. Yeah, thank you all very much for participating in the webinar. For those of you who are new or are familiar with the webinar series, we have 2 more left for the year, one in November and December. The information is online, and you'll receive it with all of the information from this webinar. The PowerPoint slides are available in PDF form online, and the recording will be made available shortly after today's session. And yes, just to close, thank you very much to all of you for joining, to Katrina, to Sandra, Pier Paolo, Dang, and Martin from 9 p.m. in Philippines to 9 a.m. in the East Coast of the US. Thank you all for joining, and have a good day for the rest of it. Thank you very much, and goodbye.
Thank you from Indian Island, Maine, USA.
Thank you.
Thanks,
Thank you
everyone.
very much. Thank you very much for having organized this.
No worries, and thank you very much, Pier Paolo, and to all of you, Pier Paolo, Dang, Martin, Sandra, Katrina. Really appreciate it. Have a lovely day that's left of it. I know, Dang, your evening is almost up, so for the rest of you, enjoy your day, and for Dang, enjoy your night.
Thank you,
Thank
everyone.
you.
Bye.
Bye.
Bye, everyone.
Bye-bye.